When Uganda confirmed COVID-19 in March 2020, the development caught many healthcare facilities in the country off guard. They immediately did not have adequate personal protection equipment that was needed to prevent the spread of the virus. Many did not have adequate supplies of water, neither did they have adequate sanitation and hygiene in place. Health facilities in Kabarole district were also equally affected. However, what was initially a great disadvantage has now been used to evaluate the quality of infection prevention and control measures. Interventions are now being undertaken to address the problem with the support of IRC. Silvia Chomuhendo is a cleaner at Chichwamba Health Center 3 in Kabarole district. She is one of the scores of support staff who have been trained in the basics of infection prevention and control by IRC in order to contain the possible spread of COVID and other infections through healthcare infrastructure. Cleaners such as Silvia are crucial in ensuring that the healthcare facilities are clean and hygienically sound all the time. They have been trained to clean them thoroughly, ensuring that all points at which patients are seen or treated are safe and secure against the spread of infection. As a casual worker, Silvia had never expected to ever be trained in how to better keep health facilities safe from infections.
Kintu kirungi amazima mu myaka yona nitu tukaba takafunaho ga training yona yo kutwegesaho omulimo gwaitu tusemereire kukora obukuba obwiro bukiro bwingi tugura abasaho nugomba ngenda kora ku training ebu naito amazima tukasemerera haba training yege katukora kurungi yatuyamba no kutugara amani no kugonza omulimo gwaitu.
Silvia has been trained under the COVID WASH intervention. Besides that, she has been furnished with personal protection equipment like hand gloves, face masks, aprons, and gumboots. The provision of sufficient amounts of personal protection equipment has made the work of healthcare personnel much safer and secure. This is besides helping to strengthen infection prevention and control measures, which were weak by the time COVID-19 struck.
We have the sanitizer, the face shields I have some here, plenty of them, the aprons I have, the examples there, the gloves I have in plenty, the jig, so I'm very happy with it.
The infection prevention and control support has helped stem COVID-19, but it has also achieved the overall goal of ensuring that patients and health workers are safer. One of the interventions under the COVID WASH initiative was capacity strengthening for healthcare workers, empowering them to use standardized tools such as the WASH Fit.
When the patient comes with malaria, should not go back with COVID. When a mother has come to deliver, should not go with another infection, should not go with diarrhea. And I, the nurse who has come with my cough, the patient I'm working on should not go with a cough at the same time.
IRC supported COVID WASH intervention in Kabarole district was triggered following the realization that healthcare facilities were ill-prepared to deal with the COVID-19 pandemic. They also lacked adequate supplies of clean, safe water and sanitation facilities that would guarantee infection prevention and control.
We found ourselves, many of our health facilities were lacking water, were lacking PPEs. The latrines or sanitary facilities were not enough. In some facilities, they were not there.
So in the process of telling us that every clinical area has to have drinking water, it has to have a washing material, it has to have waste bins in all their color codes. So that's when we realized the gap.
Realizing that response to COVID with emergency supplies was not sustainable, IRC collaborated with the Infectious Diseases Institute to boost local production of alcohol-based hand sanitizer that is now stocked in the district and on hand to supply all the 54 healthcare facilities in the district on a needs basis.
We did a number of interventions, but we finally had to also intervene in infrastructure to complement the other interventions. And the intention was to ensure that the infrastructure is safe, sanitation, water supply, and is safe, so that you again lower the chances of infection.
Another major issue was the need to safely dispose of the amounts of deadly wastes generated by the healthcare facilities. In response, IRSC has supplied color-coded waste bins and bin liners in order to segregate the waste that is generated daily. There are bins at every point of contact with patients. They are segregated in order to keep pharmaceutical waste, medical waste, and general waste for safe disposal. Not only that, IRSC has provided a modern, safe, and reliable incinerator for Kabarole district to safely burn the medical waste. It has been set up at Rutete Health Center 3. Besides providing the safe disposal of medical waste, it is set to save the district hundreds of millions of shillings that were hitherto incurred annually to dispose of medical waste at facilities outside the district. With this incinerator, it is now possible to burn the waste without contaminating the air and environment around with hazardous gases. Beyond the pandemic, IRSC is now transforming 5 pilot health centers into model healthcare facilities that address all the wash and infection prevention and control needs to meet the prescribed World Health Organization standards. Mugusu Health Center has had its problematic EcoSan toilets that the local population did not appreciate and had been abandoned for years, now being upgraded to a waterborne system.
We had the toilets, which were not enough, but now we have expanded. Because before we had an EcoSan, which was underutilized. But now since it is a waterborne toilet and we have water facilities, because we have national water, we are having harvesting tanks, so water will be available all the time.
Healthcare facilities like Chichwamba that did not have reliable water supplies are now connected to the main national water supply grid, not only for reliable access, but also to ensure that health facilities have piped safe water supply. Today, patients find the water right in the wards where they need it.
When water is readily available and it is within the vicinity of a health worker, it sticks into someone's mind that, maybe before I touch the patient, I have to wash or hand sanitize. So the lesson learned, so long as the supplies are available, human beings were able to learn and practice correctly.
IRSC and Kabarole district health officials now hope that the lessons learned can be replicated elsewhere for the good of the health and well-being of Ugandans.
We intended to mobilize resources, especially to ensure that there is water supply, because we initially started having water supply to every point of patient care is in 5 healthcare facilities. But definitely that needs to be rolled over to other healthcare facilities.